Over 39 million vaccine doses had been administered in 49 rich states, while one poor nation were given only 25 doses. The World Health Organization is warning that a me first approach is pushing the world into a catastrophic moral failure. Mavian Dog will tell us why live. Maeve, go ahead.
Jago, according to the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, it was not fair that the younger and healthier population in richer nations are getting vaccinations before the more vulnerable people in poorer states, with countries like China, India, Russia, the UK, and the US prioritizing distribution in their own populations. In fact, the People's Vaccine Alliance coalition of campaigning bodies already warned last month that poor countries were set to miss out on the vaccines because of rich countries hoarding them. Dr. Tedros said at a WHO executive board session on Monday that these actions will only push up prices and encourage hoarding, eventually leading to prolonging the pandemic and further human and economic suffering. Dr. Tedros is calling for full commitment to the global vaccine sharing scheme COVAX and is challenging all member states to ensure that COVID-19 vaccines are being administered to every country by World Health Day on the 7th of April, as a symbol of hope for overcoming the pandemic and the inequalities that lie at the root of these global health challenges. The COVAX initiative, made up of more than 180 countries that have signed up so far, is supported by the WHO and a group of international vaccine advocacy groups, whose aim is to unite countries into an alliance in order to have more power to negotiate with drug companies. Through the initiative, 92 low and middle income countries will have their vaccines paid for by a fund sponsored by donors, with 2 billion doses already secured and due to start rolling out next month. Jego?
Maeve, you mentioned that Dr. Tedros is calling for the member states to give their full commitment to the global vaccine sharing scheme COVAX. Did any of the countries react to this, and to whose warning? The WHO's warning.
Jego, UK Health Secretary Matt Hancock defended that they have provided $734 million to the COVAX program, to which he claims they have put the most financial support in the international efforts to ensure everybody has access to vaccines. Meanwhile, Canada's Minister of International Development, Karina Gold, also denied allegations in December that they were hoarding vaccines. She said that Canada was providing $380 million to help developing countries. Back to you, Jego.
Thank you, Mavian Dog, reporting live from Australia.